On behalf of the Department of Obstetrics and Gynecology at Augusta University, thank you for your interest in our residency training program. My name is Jennifer Allen, and I am the OB-GYN Residency Program Director here at the Medical College of Georgia. The residency interview process can be daunting, and time is often limited when seeking out that perfect match. Today, I would like to showcase the many opportunities we offer in our training program. I think you will find that it is very special and just might be the next place you want to call home. The Medical College of Georgia is nationally recognized as a leader in education, research, and healthcare. The MCG educational experience is anchored by the main campus in Augusta, regional clinical campuses across the state, and a second four-year campus in Athens in partnership with the University of Georgia. The impact of the state of Georgia's only public medical school spans from its founding nearly 200 years ago in 1828 as one of the nation's first medical schools. Augusta University Health is a 520-bed tertiary referral center to many regions of Georgia and the surrounding states. AU has the region's best equipped and busiest Level 1 trauma center and hosts approximately 20,000 surgeries and 85,000 ER visits annually. The AU Health Medical Office building, located adjacent to the main hospital, houses 80 general and specialty care clinics. The Women's Health Clinic and High Risk OB Clinic are located here on the 5th floor. Additionally, there are offices around the region that offer satellite care to women, including Hill Creek, Grovetown, and Lake Oconee. The AU campus also includes the 5-story Georgia Cancer Research Center, which is home to our Gynecologic Oncology Division, the $110 million AU Research Institute, and the Medical College of Georgia School of Medicine, with a state-of-the-art interdisciplinary virtual education and simulation center. Contiguous to the AU campus is University Hospital, a nonprofit 581-bed community hospital that has partnered with Augusta University in a joint academic program to enhance resident education. MCG provides postgraduate education to more than 500 residents in 51 different programs.
Hi, I'm Chad Ray. I'm currently the Vice Chair for Education for the Department of Obstetrics and Gynecology at Augusta University and the Medical College of Georgia. I've previously served in roles that include the Residency Program Director and the Associate Residency Program Director. I'm also currently the Division Director for Obstetrics and General Gynecology. I've had a long history here, almost 2 decades in the department, first as a resident and then as a faculty member. I still remain committed to the educational program, and I really hope that you find that Augusta University is right for you. We have a long history of some very unique programs, including a commitment to global health and women's health advocacy.
The goal of our 4-year fully accredited OB-GYN program is to prepare our graduates for independent practice by training them with a comprehensive education that promotes outstanding clinical care for women. Additionally, we prioritize excellence in teaching and provide mentorship for those planning academic careers. Our department prides itself on formal and informal teaching by faculty, which includes intern orientation, morning sit-down rounds, bedside rounds, protected resident didactics, grand rounds, and specialty-specific conferences. Informal teaching occurs daily on major clinical services as well as in the OR and outpatient settings. During the 4-year program, residency rotations focus on benign gynecology, which manages patients requiring preventive, diagnostic, medical or surgical care for a gynecologic condition. The ambulatory gynecology rotation provides exposure to clinics with specific areas of focus, located throughout the health system and community, such as pediatric and adolescent gynecology, bariatric women's health, menopause, breast, and colposcopy. Additionally, residents on the surgical rotation participate in gynecologic surgery at the main campus and at the Columbia County Day Surgery Center. Trainees also conduct ER consults and manage post-op patients and ER follow-up patients in the GYN Continuity Clinic weekly. The Gynecologic Oncology rotation offers education about multidisciplinary care for the oncology patient. Residents are exposed to radical procedures, minimally invasive robotic procedures, chemotherapy, radiation therapy, and care of complex patients with multiple comorbid conditions. Enhanced understanding of pelvic anatomy, critical care, and female malignancies, as well as improvement in advanced surgical skills, are accomplished on this rotation.
Hi, my name is Benjamin Rand. I currently serve as the Fellowship Director and the Division Director for Gynecologic Oncology. We look forward to meeting you here for your visit. I currently serve as the Fellowship Director for our ACGME approved 3-year fellowship program in Gynecologic Oncology. We take 1 fellow per year. Fellows augment resident education here by serving as an additional layer of teachers, both overseeing residents on the inpatient service as well as in the operating room, operating with them as supervising physicians. From a resident perspective, you have the opportunity to take care of a variety of complex patients on the inpatient side, as well as a high volume of surgical cases. We do a lot of both open and minimally invasive cases, including a large volume of minimally invasive hysterectomies, both laparoscopically and robotically.
The general obstetrics rotation and the maternal fetal medicine rotation provide education about maternal anatomy, physiology, and developmental biology, and enhances knowledge of the antepartum, intrapartum, and postpartum care for women. Residents are exposed to genetics, sonography, vaginal and operative delivery, and a wide variety of antepartum and postpartum complications. The MFM rotation provides education about abnormal high-risk pregnancy conditions, perinatal genetic diagnoses, and incorporates routine collaboration with an in-house genetic counselor. AU OB-GYN residents have access to our Level 4 perinatal center. The NICU has 42 beds and usually runs close to 100% occupancy, providing care to a whole spectrum of infants from the extremely premature infant to the term infant with diaphragmatic hernia or congenital heart disease. The NICU has been recognized as an ECMO Center of Excellence since 2006 and is one of only 2 centers in Georgia that provides ECMO. Because at Augusta University we have the ability to care for very premature and sick infants, we are a referral center for extremely complicated pregnancies from all over the state of Georgia and surrounding states. The reproductive endocrinology and infertility rotation offers training in recognizing a wide range of clinical problems, from aberrations of puberty to infertility and menopause. Specific programs related to in vitro fertilization, preconceptional and prenatal genetic diagnosis, transgender medicine, and pediatric gynecology are part of this clinical service as well.
Hello, my name is Dr. Larry Lehman. I'm a reproductive endocrinologist and clinical geneticist. There's been a long tradition of reproductive endocrine and genetics at the Medical College of Georgia at Augusta University. I'm proud to be the section chief of REI and genetics and the program director of the REI Fellowship. We offer a 3-year fellowship in REI, and our fellowship is half clinical and half research, with the goal of producing productive clinical reproductive endocrinologists and physician scientists. Residents are actively involved in our program, and they will see patients with us and with the fellow and get exposure to a wide variety of clinical REI.
During the female pelvic medicine and reconstructive surgery rotation, residents work with faculty to acquire the skills necessary to evaluate and treat women with pelvic floor disorders, such as urinary incontinence and pelvic organ prolapse. They are exposed to minimally invasive robotic surgery, laparoscopic surgery, and vaginal surgery.
My name is Dr. Barbara Henley, and I am the Chief of Female Pelvic Medicine and Reconstructive Surgery here at Augusta University. I'd like to be one of the many that welcome you to our institution. Welcome. Our team here at Urogynecology consists of myself, Dr. Jennifer Lanzer, who is also a fellowship-trained urogynecologist, and a physician's assistant, Melania Velasquez, who has been with us for several years. We also have an amazing nursing staff, and our entire team is involved in educating our students and residents. Our residents spend 3 rotations with us that are currently each 5 weeks. During these rotations, they experience time in the office, seeing our patients, learning about urodynamics, office procedures, and of course they spend plenty of time with us in the operating room, doing vaginal surgery, robotic surgery, and laparoscopic surgery. I really hope you consider our institution. You will not be disappointed.
Built into the block schedule is a 5-week global health rotation in which residents travel to Cusco, Peru, and provide exceptional gynecologic care to women in the Third World. Residents work alongside physicians and medical students honing their colposcopy skills. Many choose to travel to Machu Picchu while there, crossing one of the 7 wonders of the world off their bucket list. Formal teaching occurs routinely in the OB-GYN department at AU. Designated protected didactics occur each Friday morning, and a 2-year rolling curriculum is followed and managed by the Director of Education and the Education Chief Resident. The curriculum is published for the academic year and readily available to residents on their smart devices. The didactic curriculum follows a monthly format with topics that rotate weekly, including GYN, subspecialty, OB, simulation, and wellness. Topics are chosen from the CREOG educational objectives. Formal instruction is given by dedicated full-time faculty, and virtual didactics has become commonplace via platforms such as Microsoft Teams and Zoom. The lectures are also recorded and archived for later viewing. Resident knowledge is tested annually by administering the CREOG in-service exam and a mock oral exam. Trainees produce a case list each year and have the opportunity to travel with AU faculty to the Simulation Center in Greenville, South Carolina, to participate in a genuinely simulated mock oral exam with faculty from Mayheck Asheville and USC Greenville. The Department of OB-GYN has a strong commitment to research and is ranked 11th nationally in NIH funding, ahead of many of America's most prestigious universities. Over the years, trainees have participated in both clinical and basic science research. It is the program's expectation that each resident complete 1 or more research projects during their training at AU. A formal research curriculum is utilized by our Director of Scholarship to educate residents on resources for research, how to navigate the IRB process, and provide accountability with a timeline for project completion. Augusta University is a leading high-volume robotic surgery center that provides access to the area's largest, most experienced team of robotic surgeons across a range of specialties. Our department has a robust multidisciplinary robotic surgery curriculum that allows residents to become proficient in minimally invasive gynecologic procedures with the use of high-fidelity robotic XI and SI simulators. The main OR houses a dual console for additional teaching and training during live cases. A fully equipped laparoscopic skills lab is utilized to train residents to become proficient laparoscopic surgeons by adhering to the fundamentals of laparoscopic skills curriculum. Live porcine labs and low-fidelity models are incorporated throughout the year for additional hands-on learning. Our Director of Virtual Education and Simulation works closely with the Medical Illustration Department to construct 3D models of pelvic organs that are used in multiple ways for procedural simulation for our trainees. In addition to education, research, and patient care, our department is strongly committed to service. In the fall, the GYN Oncology section and the CSRA GYN Cancer Support Group host an annual wine tasting and silent auction to raise money for local charities and to support activities for our GYN cancer patients. In the spring, the General OB-GYN section in Stager Strong hosts an annual 5K in honor of our former Program Director, GYN Section Chief, mentor, advisor, colleague, and friend, Dr. Bob Stager, who passed away from T-cell lymphoma in 2019. Residents and students are very involved in this event, and it has become a beloved tradition.
So we hope that you choose the Medical College of Georgia for your training program, and we look forward to the opportunity to work with you soon, and we look forward to meeting you. Thank you.
We hope that you'll consider Augusta University and attend our residency, and we welcome you when you come. Thank you.
I hope that you find that Augusta University and the Medical College of Georgia meets all of your needs. And if so, we hope to see you next summer.
I really hope that you choose Augusta University. This is a great place to learn, and we look forward to meeting you, welcoming you to our family, and helping you become the best OB-GYN that you can.
I hope you can see now why I love this residency program. As a former resident here at AU, I found that the most valuable asset of this training program is our people. Our educational mission is focused on professional development and personal growth. Our residents and faculty have an excellent working relationship as we work toward a common goal, and our department is truly a family of support. We are very proud of the opportunities we have to offer you here at Augusta University, and we look forward to meeting you soon.